Biostimulation with MCDB106 is done with the mesotherapy injector. Set the injector to rapid pulse mode, slightly press the injector against the face and direct it to cover the whole face. The stimulating action on the skin with MCDB106 is reinforced by the stimulation of the needle. This action will be maximized if Hydractive is previously applied in papules all over the face. When applying Mesoglow, it is recommended to use an anesthetic gel. Disinfect the area to be treated. Slightly bend the needle bevel upwards. Push the needle against the skin. Create micropapules by injecting 0.02 ml of Hydractive in very superficial points, about 1 mm. Separate the papules from between 0.3 to about 0.5 cm. Stretch the skin as much as possible to facilitate the injection. Should slight bleeding occur, simply apply light fingertip pressure. As the lower part of the face represents a large area, it can be treated using the retrograde technique, always very superficially. At the end of the treatment, massage the treated area with a moisturizing cream. Spread the cream. Then massage with the whole hand, applying pressure to the face. The massage will spread Hydractive evenly and rapidly smooth out the micropapules. To determine the area to be injected, do a pincé roulé on the abdomen. A roll of fat is revealed where the treatment is necessary. Define the area with a dermographic pencil. Set the depth of injection of the mesotherapy injector to 4 mm. Inject every 1 to 2 cm by stretching the skin with your free hand or by pinching it to create a fold. Applying Cellulift on the thighs does not require any anesthesia. Cellulift can also be applied with a nappage technique. Slightly bend the needle, bevel upwards. Push the needle against the skin, draw a line with the needle in a smooth motion back and forth, allowing the needle to penetrate the skin very superficially to about 1 mm. The movement starts from the elbow and not the wrist. Leave 1 to 2 cm between lines. Cover the whole area to be treated. When treating the lips by injection, it is recommended to use local anesthesia. Inject in the lip with the retrograde technique. Then at the junction of the dry and moist lip. This technique will smooth out and add volume to the lips. Hydractive in Cellulift is the most suitable solution for treating this indication, thanks to its moisturizing, volume and lifting effect. Should slight bleeding occur, simply apply light fingertip pressure. A local anesthetic must be injected in the lips. This can be a local anesthetic using this simple guide. The supraorbital nerve, the infraorbital nerve and the mandibular nerve all emerge along the same vertical line, which joins the infraorbital foramen, the axis of the pupil in median position and the edge of the mouth. Join this line to that which joins the base of the side of the nose to the outer canthus. The infraorbital nerve emerges at the intersection of these two lines where the injection will be made. Disinfect the area before injection. Inject 0.5 cubic centimeters xylocaine with adrenaline to 1% in the infraorbital nerve on each side. Should slight bleeding occur, apply light fingertip control for a few seconds. Local anesthesia can be administered in the same way as in dental surgery, namely by injecting at the angle of the gums and the mucous membrane. Inject about 1 milliliter with several little injections from each side, with 0.5 milliliters for the top lip, When applying cellulase on the face, it is recommended to use an anesthetic gel prior to injection. It is preferable to inject the palpebral pouches manually. Slightly bend the needle, bevel upwards. Inject point by point to a depth of between 1 and 2 millimeters. Inject a first line of 4 points on the top of the lower eyelid. Then inject a line of 3 points below, then 1 or 2 points on the next line. Applying Keractive does not require any anesthesia. Create a parting by either wetting the hair or applying hair gel to maintain the hair in position. Each parting represents a line for injection. Disinfect each parting. For the automatic technique, set the injection depth of the mesotherapy injector to between 1 and 2 millimeters. Create a small skin fold by pushing one way with the injector site and in the opposite direction with your free hand. Inject every centimeter. Separate each parting by about 1 centimeter. Inject in each parting by covering the whole scalp except the back of the head where the hair is genetically programmed not to fall. For the manual technique, the procedure is the same. Slightly bend the needle, bevel upwards. Create a small skin fold by pushing one way with the needle and in the opposite direction with your free hand.